Breast cancer remains a major health concern worldwide, affecting millions of women each year. According to recent estimates, about 2.3 million females were newly diagnosed with breast cancer in 2022. This staggering number highlights the urgent need for effective diagnosis and treatment options. The disease not only impacts patients physically but also emotionally and financially, as families and communities rally to support loved ones. With ongoing research and advances in medical technology, there is hope for improved outcomes and quality of life. Today, we explore a groundbreaking development that could change how breast cancer is treated, especially for early-stage cases. When it comes to breast cancer, treatment options vary depending on the type and stage of the disease. Common approaches include chemotherapy, radiation therapy, hormone therapy, targeted medications, and surgery. Each method has its own benefits and risks, and doctors carefully tailor treatments to individual patient needs. For some, chemotherapy is essential, while others may benefit more from hormone therapy or surgery. The complexity of breast cancer means that no two cases are exactly alike, making personalized care crucial. As we move forward, understanding these options helps us appreciate the importance of new tools in guiding treatment decisions. One of the biggest challenges in breast cancer care is the risk of recurrence and metastasis. Recurrence refers to the cancer returning after treatment, while metastasis means the cancer has spread to other parts of the body. Different types and stages of breast cancer have varying rates of recurrence and metastasis, making it vital for doctors to assess each patient's risk. This assessment guides decisions about treatment intensity, aiming to prevent the cancer from coming back or spreading. Accurate prediction tools are essential for helping clinicians and patients make informed choices, balancing the need for effective therapy with minimizing unnecessary side effects. Major breakthrough has arrived with the FDA's approval of the ArteraAI Breast digital pathology-based risk stratification tool. This innovative platform uses artificial intelligence to help doctors predict the likelihood of metastasis in patients with early-stage hormone receptor-positive (HR+), HER2 negative invasive breast cancer. By analyzing digitized pathology slides and clinical variables, Breast provides a personalized risk score, sorting patients into low or high-risk groups. This information empowers oncologists to make more precise treatment decisions, potentially sparing patients from unnecessary chemotherapy and its associated toxicities. Breast operates by scanning a patient's pathology slides from surgical tissue. These digitized images, along with clinical variables, are fed into a multimodal AI model. The model was trained on data from over 8,500 breast cancer patients from clinical trials, allowing it to accurately predict the risk of metastasis or recurrence. The AI then sorts patients into low or high-risk groups based on their risk score. This process is fast, efficient, and leverages existing clinical and histopathologic features, making it a practical tool for oncologists. The goal is to guide therapy decisions with greater precision and confidence. Personalized medicine is at the heart of modern cancer care. Breast helps oncologists determine the optimal level of therapy for each patient. Those with a lower risk profile may avoid intensive treatments, while higher risk patients receive more aggressive care. This tailored approach reduces the chances of undertreatment or overtreatment, ensuring patients get exactly what they need. The AI-generated risk score and group assignment provide clarity, helping both doctors and patients make informed decisions. By focusing on individual risk, Breast supports better outcomes and enhances the patient experience. For years, doctors have relied on the Oncotype DX test to assess the risk of systemic metastasis and guide chemotherapy decisions. This test analyzes tumor features and provides a recurrence score, separating patients into low, moderate, or high-risk groups. However, Oncotype DX can be costly, may take weeks to process, and is not always available before surgery. Insurance coverage is often limited to post-surgical cases. Breast offers a faster, more accessible alternative, using existing clinical and histopathologic features to assign risk groups without the delays and expenses of traditional methods. One of the standout benefits of Breast is its potential to reduce costs and time delays compared to existing tests. By utilizing immediately available clinical and histopathologic features, the AI model can quickly assign patients to risk groups. This efficiency means doctors can make treatment decisions sooner, without waiting for lengthy lab results or incurring high expenses. The streamlined process not only saves money but also helps patients start appropriate therapy faster, improving their chances for successful outcomes. Accessibility and speed are key advantages in today's fast-paced healthcare environment. Chemotherapy can be a life-saving treatment, but it also comes with significant short-term and long-term side effects. These include neuropathy, increased infection risk, and impacts on fertility. ArteraAI Breast's ability to accurately stratify patients means that those who are unlikely to benefit from chemotherapy can safely avoid it. This spares them from unnecessary physical, emotional, and financial burdens. For many postmenopausal women with node-negative tumors, the decision to recommend chemotherapy is often unclear. The new AI tool provides much-needed clarity, helping doctors and patients make safer, more confident choices. For widespread adoption, Breast must be validated through robust, peer-reviewed clinical trials. Experts emphasize the need for long-term follow-up data, comparing its performance against current gold standards like Oncotype DX. This evidence should demonstrate at least equivalent, if not superior, patient outcomes in terms of disease-free and overall survival. Additionally, practical considerations such as real-world turnaround times, cost, insurance coverage, and integration into existing workflows must be addressed. Transparency in the AI model's features and risk assessments is also crucial for building trust among clinicians and patients. Transparency is a key concern for clinicians using AI tools like Breast. Doctors need to understand the features driving the AI's risk assessments, moving beyond the black box concept. This understanding ensures that treatment plans are based on reliable and accurate information. As AI becomes more integrated into healthcare, ongoing education and collaboration between technology developers and medical professionals will be essential. By demystifying the AI model, clinicians can confidently use it to guide therapy, knowing it aligns with best practices and patient safety. It's important that new tools like Breast are evaluated across diverse populations. Breast cancer affects women of all backgrounds, and treatment outcomes can vary based on factors such as race, age, and genetics. Clinical validation should include long-term follow-up for different groups to ensure equitable care. By considering diversity in research and implementation, the medical community can address disparities and improve outcomes for everyone. The goal is to make personalized, AI-guided therapy accessible and effective for all patients, regardless of their demographic or clinical profile. Breast to be successful, it must integrate smoothly into existing clinical workflows. Doctors and healthcare teams need clear answers on turnaround times, costs, insurance coverage, and practical implementation. The transition to AI-guided therapy should be seamless, minimizing disruptions and ensuring that patients receive timely, accurate care. Collaboration between technology providers and medical institutions is vital for overcoming challenges and optimizing the use of AI tools. As adoption grows, ongoing feedback and improvements will help refine the process and maximize benefits for patients and clinicians alike. FDA's approval of Breast marks a significant milestone in the evolution of breast cancer care. As AI and digital pathology become more prevalent, the potential for personalized, efficient, and effective treatment grows. Ongoing research, clinical validation, and collaboration will shape the future, ensuring that new tools meet the highest standards of safety and efficacy. Patients and clinicians alike stand to benefit from these advances with improved outcomes, reduced burdens, and greater clarity in treatment decisions. The journey toward better breast cancer care continues, driven by innovation and dedication. Summary: Breast represents a promising step forward in breast cancer treatment. By harnessing the power of artificial intelligence, doctors can make more informed, personalized decisions, potentially sparing patients from unnecessary chemotherapy and its side effects. While further clinical validation and practical integration are needed, the benefits of reduced cost, faster turnaround, and improved accuracy are clear. As technology continues to advance, the hope is that breast cancer care will become more precise, accessible, and compassionate. The future looks bright for patients, clinicians, and the medical community as a whole.